Audiologists diagnose, manage, and treat hearing loss and balance disorders in people of all ages from infancy all the way up to adulthood.
Services include assessing ringing in the ears, fitting hearing aids, and counseling patients and families on good communication strategies that maximize conversation. I'm audiologist Dr. Kaitlin Lafreniere.
And I'm audiologist Dr. Tonya German with Salina Regional ENT and Audiology.
Ladies, thank you so much for coming on the show. We're going to be talking about audiology. First of all, tell us, what is audiology and what do you as audiologists do?
So audiology is a science regarding sound, and so what we do is we evaluate and assess how the human body is accessing and perceiving sound. We do that from infants all the way up to individuals who are elderly, and at different milestones we evaluate if there are any medical conditions that may be impeding that could be medically treated by an ear, nose, and throat physician, or something permanent that need to be treated long-term through assistive devices.
When should somebody come to see an audiologist?
So one example is if you're having trouble hearing, like in a restaurant. It's noisy, it's crowded, there's lots going on, and you're having trouble hearing that person across from you. That is the perfect time to come and see us. If you've noticed that you have ringing in your ears, that is another time that you would want to come and see us.
My favorite one is if somebody else says you can't hear them, now it's time to get your hearing tested.
Why don't you talk about what you do with people with their hearing aids?
So we do fit hearing aids to the patient. We also have patients come in if their hearing aids need adjustment, if their hearing aids need cleaning.
We do expect hearing aid to change just with age. So when hearing changes, those hearing aids do need to be reprogrammed.
Why don't you take us through a typical appointment at the clinic?
So a typical visit is, the first visit tends to be a hearing test. So when you come in, we talk about your history. Did you have any ear problems in childhood through early adulthood, depending on age? I'm going with somebody is elderly at this point. We talk about any other symptoms, any ear pain, pressure, medical reasons you might need to see another type of specialist. We work from the outer ear into the inner ear. We look at it, we check for wax, we check for things that might be obstructing sound. We assess the middle ear function, and then we assess the inner ear function as well. From there, we put all that together and say, this is how we expect your hearing to be affecting day-to-day life. And then from there, we also take what we see on paper and what our patient is reporting their day-to-day difficulties are to making long-term recommendations.
Well, ladies, thank you so much for some great information, and thank you for watching. For more information, please visit Salina Regional ENT and Audiology and like Salina Regional Health Center on Facebook. Follow us on X and Instagram.